Hepatitis C is a viral infection that can lead to liver inflammation and damage. It is spread through blood and bodily fluids, so if you use intravenous drugs, you are at a higher risk of getting hepatitis C. If you use needles to inject drugs, you can catch hepatitis C by sharing needles with someone who has the virus. You can also get hepatitis C from using equipment like cookers, cottons, water, ties, and alcohol swabs to prepare drugs, touching infected blood, or coming into contact with contaminated surfaces. For drug use can lead to a number of health issues, in addition to hepatitis C. These include overdose. For drugs can be especially harmful when misused, as they are injected directly into the bloodstream, leading to a higher risk of overdose. Unusual weight loss. Injecting illicit drugs can trick the body into thinking it has more energy than it actually does, leading to significant weight loss as the body requires more calories to stay awake. Abscesses. Repeated drug use can result in painful abscesses, which are collections of pus beneath the skin, as well as other skin infections and inflammation. Vein collapse. Injecting drugs into the same spot repeatedly can cause scarring and bruising, leading to vein collapse, which occurs when the interior lining of the vein swells and prevents proper blood flow. Skin ulcers. Poor blood flow resulting from drug misuse can lead to open wounds that do not heal properly, forming skin ulcers. If left untreated, hepatitis C can lead to various health problems such as liver scarring, also known as cirrhosis. This condition can make it difficult for the liver to function properly. In advanced stages, cirrhosis can result in liver failure, where the liver stops functioning altogether. Additionally, hepatitis C may also increase the risk of developing liver cancer, although this is rare. This virus can also affect you in other ways, increasing the risk of having an overactive thyroid, hyperthyroidism. Having an underactive thyroid, hypothyroidism. Developing type 2 diabetes. Developing heart disease. Developing non-Hodgkin's lymphoma. Experiencing jaundice. Experiencing changes in your thinking and mental abilities, cognitive impairment. Developing Parkinson's disease. Developing arthritis. Developing gallbladder problems. If you're unable to stop injecting drugs, there are measures you can take to protect yourself from hepatitis C. Do not share drug injection equipment. Use new equipment every time, such as cookers, cottons, water, ties, and alcohol swabs. Clean every surface that your drug equipment will come into contact with. Avoid using syringes with detachable needles. Wash your hands thoroughly with soap and water before and after injecting. Clean the area on your body where you plan to inject with alcohol or soap and water. Keep a close watch on your injection equipment to avoid sharing. If you use drugs, it's important to get tested for hepatitis C, especially if you currently inject drugs. Your doctor may test you by collecting a blood sample and testing it in a lab to confirm whether you have hepatitis C. If the first test is positive, more tests will be done to determine the virus genotype and measure the amount in your blood. Your doctor may also check for liver damage by conducting a liver biopsy, blood tests, and ultrasound to determine the level of fibrosis in your liver and to gauge stiffness.